How do commercial determinants of health impact liver health in Europe?
The most common liver diseases in Europe are alcohol-related liver disease and metabolic dysfunction-associated steatotic liver disease. Both diseases are heavily affected by environmental and behavioral factors and are therefore preventable diseases. Europe has the highest level of alcohol consumption in the world, which together with unhealthy ultra-processed food consumption and high prevalence of obesity are the major drivers of liver-related morbidity and mortality. Commercial pressures affect consumers' choices, which is shaped by the food industry and policy. Moreover, commercial pressure sometimes specifically targets lower socioeconomic populations of children and adults. Children in Europe are regularly exposed to marketing that promotes ultra-processed food and high-energy drinks consumption. Such targeting of children and adolescents by the food and beverage commercials, in particular those embedded in children's TV program and electronic media like video games and social media, has been shown to drive consumption of high-calorie and low-nutrient quality beverages and food. Studies also consistently reported that exposure to alcohol marketing increases the risk that young people will start to drink alcohol or, if they already drink, consume greater quantities.
How can policy help to address commercial determinants of health in the EU?
It is essential to address and adopt population-level strategies that modify the environmental drivers of behavioral risk factors in order to relieve the human and financial costs associated with liver disease. A successful health policy will include a response to commercial forces working through rapidly evolving digital media. The EASL Commission strongly believes that the only effective solution will be a complete ban on all forms of alcohol marketing, including digital marketing. Food marketing regulation is also important, for example, by preventing the food industry from putting children's cartoons on food packing, preventing educational institutions from offering unhealthy products, restricting TV marketing, prohibiting promotional toys given to children, and forcing producers to place warning signs on their packing in case they exceed the established limits of total sugar and saturated fats.
What policy initiatives are EASL prioritizing or collaborating on in the coming year?
EASL works on several levels. First, gathering scientific evidence that supports policy measures' effectiveness in reducing liver disease burden. For example, EASL recently published the EPA-Health 2 study, showing that policies of minimum unit pricing on alcohol and taxation on sugar-sweetened beverages, or the combination of both, have important impact in reducing the predicted number of Europeans who develop chronic liver disease and liver cancer. Second, by education. For example, the second EASL Commission focuses on commercial determinants of health and social determinants of health in relation to liver disease in Europe, suggesting ways to minimize alcohol and unhealthy food aggressive marketing harms, especially among population from low socioeconomic status. This topic is also covered in EASL conferences and EASL studio episodes and webinars. Third, by advocacy. EASL is collaborating on several strategies that are geared toward addressing commercial determinants of health in our policy initiatives. Our latest policy statement calls on the EU to accelerate public health policies to reduce the high human and financial burden of liver disease. In this document, we outline policy measures that would have significant impact on the burden of liver disease in Europe. We ask policymakers to adopt policies that ban marketing of unhealthy products and increasing excise taxes on sugar-sweetened beverages and alcohol products.
What is Europe's Beating Cancer Plan, and what factors led to its development?
Europe Beating Cancer Plan is an EU approach to cancer prevention, treatment and care. It addresses the entire disease pathway from prevention to quality of life for cancer patients and survivors. It is a shared vision, more importantly, and a joint commitment by policymakers and stakeholders, and with it we have made huge strides.
How does the plan aim to improve early detection and screening programs across member states?
Now, one of the plan's priorities is better early detection, and the new EU cancer screening scheme is one of the landmark results. Now, I go back to December 22. The EU health ministers adopted an updated recommendation on cancer screening. It sets out a goal of offering breast, cervical and colorectal cancer screening to 90% of the eligible EU population, but it also aims to test the feasibility of lung, prostate and gastric cancer screening. Now, these cancers were selected based on their disease burden and where screening test performance has been investigated in large-scale trials.
How will populations in Europe living with liver cancer be included in future cancer screening planning?
Let me tell you how the Commission is addressing liver cancer as part of the plan. First, we are working to ensure access to vaccination against hepatitis B and to treatments to prevent liver cancers associated with hepatitis C. For instance, a project called VH-ComSavac, which is a multi-country project, has been running since November 2022. It focuses on scaling up and adapting community-based viral hepatitis testing and hepatitis B vaccination models of care among marginalized populations in Spain, Italy and Greece, people who might not reach ever the health system. The project will run until April 25, raising awareness, sharing its findings and helping reducing deaths associated with liver cancer in these regions. In June of this year, the EU health ministers adopted a Council recommendation on vaccine-preventable cancers. This will support member states in reducing the cancer burden linked to infection with human papillomaviruses and hepatitis B virus. The recommendation will do this by boosting the uptake of vaccines and helping countries better monitor vaccination coverage. To help member states implement this, the Commission will launch a €20 million joint action to address cancers caused by infections, vaccine-preventable cancers and also communicable diseases. The Commission will also launch a call for proposals targeted to stakeholders to support and complement the work of member states in this joint action. We're also driving better data on cancer in Europe, including on liver cancer. We have created the European Cancer Inequalities Registry, which identifies trends and disparities and inequalities between and within member states and regions. And it includes comprehensive data linked to viral hepatitis and liver cancer. Finally, this year, we published a fact sheet on liver cancer inequalities and the role of viral hepatitis in Europe. It analyzes the data and has policy recommendations for reducing inequalities and better reaching vulnerable groups. Data is a powerful tool to guide evidence-informed policies. I encourage everyone to make use of it so we can move towards a future where everyone has the same access to early detection and high-quality care. Thank you for your attention.